Hospital. She is a graduate of University of Ghana Medical School. She did her postgraduate fellowship at the West African College of Physicians. She is a fellow of the Royal College of Physicians in London. She is also a fellow of the American College of Physicians. She is a vice president of the Ghana Association for the Study of Liver and Digestive Diseases and a board member of the International Hepatitis Society in the USA. She is also a member of the European Association for the Study of Liver Disease and a member again of the American Association for the Study of Liver Diseases. She has done several research work in hepatitis, COVID, and HIV. She is also a member of the technical committee of the National Viral Hepatitis Program, and she played a key role in the guidelines on the management of viral hepatitis, HIV, and TB. So without wasting much time, I'm sure with all that I've mentioned, you can see that we could not find any better person, more experienced than Dr. Adwoa Adjei in cancer. So Dr. Adwoa Adjei, your audience, they are online and in person here on Facebook, YouTube, and Zoom. And she'll be talking about hepatitis demystified. All the public need to know. Dr. Adwoa Adjei, your audience.
Thank you very much for such a wonderful introduction. If you don't mind, since I'm observing social distancing, I'll take off my face mask so my voice will be clearer. Thank you. Now, we all know that yesterday was World Hepatitis Day, and with the World Hepatitis Day, WHO says that hepatitis cannot wait. Now, all attention has been drawn to COVID-19. All resources going to COVID-19. But we should remember that our younger folks are dying from hepatitis and hepatitis-related complications. Now, to understand the disease, you need to really know what the disease is, how the symptoms are, the severity of the symptoms, and even being able to pick up the red flags. That will help a long way. And then we're going to give the general public the facts regarding hepatitis B. Because if you understand and you are empowered in terms of your knowledge, then you know what to do. As our good man said, he says that if the purpose of something is not known, abuse is inevitable. So we should know the purposes of the investigations, etc., that we are doing, and then the importance of the disease. Now, when we talk about hepatitis, it comes from two words, hepa, meaning the liver, which is a Latin word, and itis means inflammation. So when we talk about viral hepatitis, we mean a virus causing an inflammation to the liver. And there are different types of viruses. We have hepatitis A, B, C, D, and E. With A and E, they usually tend to cause acute infection, by which I mean within a few months, almost everybody is able to clear it. But the notorious ones are hepatitis B and C, because they have the tendency of causing acute as well as chronic infection. So I'll be biased in this presentation, talking more about hepatitis B, which is very common in our part of the world, and a bit on hepatitis C. Now, if you look at this graph, it tells us about the prevalence of hepatitis B in the whole world. And then areas that are coded red are areas with high prevalence of hepatitis B. So that for those areas, their prevalence, meaning that if you take any 100 people, the minimum number, 8 of them will have hepatitis B. Various research work has been done in Ghana, and our prevalence ranges from 8 to 15%. Now, the other thing is that those with this high prevalence, they also have a higher prevalence of liver cancer, because the commonest cause of liver cancer in our environment is hepatitis B. The other part of it is that this is a preventable disease. Taiwan used to be a very big source of hepatitis B in the world, but they put in measures. vaccination treatments were available, but those were introduced, and it's no longer a problem. But Ghana, day in, day out, our numbers are increasing. What are we doing? So one of the important things we're talking about is that, look, this is what we have observed in our country. We are not going to be spectators. We're going to be citizens, and therefore we're going to make noise about this hepatitis B, so that those who have it will seek care, and those who don't have it, preventive measures, promotive measures will be instituted. Now let's look at the myth with regards to hepatitis. People think that when you have hepatitis A, and then it grows, it becomes hepatitis B. And when B grows, it becomes C. When C grows, it becomes D, etc. That is not true. Now, there are different types of viral hepatitis, as I have said. A, B, C, and D. Although they have the same surname, they are different viruses. So A cannot give you B. Although the modes of transmission are similar, A and E is very different, but with B and C, their mode of presentation is about the same. In terms of their symptoms, it's basically almost the same, but they are different. Now let's look at what is going on in Ghana. These are the 4 major diseases that is in Ghana. One of the things is malaria. And per year, globally, about 850,000 people die every year from malaria. We have a malaria program which is well financed, which is doing very well. And then it comes to TB. About almost 1.3 million people die from tuberculosis every year globally. We have the TB program. We have free drugs for TB, investigations for TB, all free. That's very good. Now let's take HIV. 1.34 people per year will die from HIV. Yes, we have invented they are free. Kudos to whoever is doing that. Now let's come to hepatitis B. Per every year, we have 1.45 million people dying from hepatitis B. Do we have a national program? Yes. Is it being sponsored? No. Are the patients' investigations for free? No. Are patients' drugs for free? They are hepatitis B. It's just the tip of the iceberg. Lots of people are walking around will be an advanced disease. They may come in with their cirrhosis. They may come in with their cancer. Should we wait for them to come in? No. It's always important to have a preventive as well as a promotive approach when you think about diseases. And that is what Kolebu is trying to do and we are doing. Now let's look at how one vertical transmission. So a mother who has the virus can pass it. Is that any country whose prevalence is more than 8? Explain. When you get the virus the first time as chronic carriers. Now if you acquire the infection between ages 1 and 5, then 30 to 50% will continue to carry the virus. As adults, if you are first exposed, less than 5% will be chronic carriers. So that tells you that most of the hepatitis B we are seeing, it's being fueled in terms of things to prevent mother to child. Do we have the birth dose? No. Do we treat mothers who are positive for hepatitis B? No. Are pregnant women routinely screened as per national program? When it comes to hepatitis B, no. But when it comes to syphilis and HIV, they are being screened. Why can't we convert our dual elimination to a triple elimination where we do hepatitis B, HIV, and syphilis? Now, there are other ways of also acquiring the infection, although this is not the major route of transfer. One is intravenous drug users. They jab themselves, they pass on that same needle to the next person. So if the person has it, then passes on the virus. In institutionalized people, they do all sorts of things. And that can also promote the transfer. Healthcare workers, needle stick injuries, etc., can also predispose one to getting hepatitis B. And individuals with multiple sexual partners, and then transplant and transfusion recipients, as well as patients who are on hemodialysis. That is why every patient who needs hemodialysis needs to be screened for viral hepatitis. Now, if a mother has hepatitis B and the surface antigen is positive, about 70 to 90% of the infants that are born will be infected with the virus. And these children, 90% will carry it for the rest of their lives. Now, if the mother is surface antigen positive, but E antigen negative, then there's a 5 to 20% chance that the baby will be infected. And once the baby is infected in the neonatal period, 90% of them become chronic carriers. Where do we find the viruses? They are high in the blood, in the serum, and then in wound exudates. Then they can be found moderately in semen, vaginal fluid, and saliva, and very low or undetectable levels when it comes to urine, feces, sweat, breast milk. Now, what is the myth surrounding the transmission of hepatitis B? When people think that casual contact, shaking somebody, coming into contact with sweat, eating in the same bowl with a person, using the same cutlery will cause one to get hepatitis B. No, you will not. There should be blood and blood product exchange. That is when you get the infection. Now, others are thinking that, oh, if I have hepatitis B, then maybe the mosquito. No, mosquito will not transmit hepatitis B. And some people think it's genetically transmitted. It is not. It is during the process of childbirth, when the blood of the mother mixes with the child, that is when they have the infection. So hepatitis B is not a genetically transmitted disease. Now, people think that, oh, those who have viral hepatitis are sinners, especially when it comes to our prophet of today. No, hepatitis B does not make you a sinner. A newborn who gets the infection, what sin has this newborn child committed? So please, let us know the truth, that it is not, people don't get infected because they have sinned. Innocent people also get infected. Now, some people also think that once I am diagnosed with hepatitis B or C, then it means I'm going to die. I need to do my will. Everything comes to a standstill. That is also a myth, because for hepatitis C, it is curable. Hepatitis B, there are drugs available. There are expertise, people, experts in the management of these diseases in Korle Bu. Investigations that you need to do are available in the Korle Bu Teaching Hospital. Don't sit in your rooms and die from the emotional and psychological stress. Come to Korle Bu, we will do you good. Now, why do I say that being diagnosed with hepatitis B is not equal to dying immediately? If you look at the natural history, if you get the infection, you get chronic infection to the time of death, it may take you about 30 to 50 years if nothing is done about it. But if something is done about it, even this progression can be halted. So don't stay at home. But there are certain things that when we do, it increases our chances of developing complications. Taking alcohol, use of herbal medication for diabetics who develop fatty liver disease. That can also accelerate your progress of the liver disease. So make sure that if you are diabetic, you have hepatitis B, good control of your diabetes, good control of your sugar levels, good control of your lipids will also help us. Now, how do people with hepatitis B present? Majority of them who come in with chronic infection, like you and I, do not have any symptoms at all. The symptoms that we see are in patients who have the acute disease, and they may have loss of appetite. Usually, it sounds more like malaria. Most people will treat themselves as malaria until the appearance of the jaundice, when somebody may decide to screen them for hepatitis B. Now, the other thing is that some of them may present with complications, and it may be early or late. Majority of them in the long-term complications, early one, severe form can cause liver failure and death. And then with the late complications or the long-term, we have what we call cirrhosis, where the liver tissue, which is usually spongy, becomes like a scarred tissue. Or they may develop hepatocellular carcinoma, what is termed liver cancer. Now, this is a patient we saw who has a typical liver cirrhosis. You can see how the feet are swollen, and you can see the abdomen. This is fluid accumulation because the liver wasn't working well. And we don't want patients to present in this case. That is why we are always advocating for preventive and promotive care rather than waiting to cure our patients. So this is another patient with liver cancer where you see a bulge on the right side of the abdomen. The same thing, this patient has lots of fluid in addition to the liver cancer, and jaundice is one of the features that will actually alert one that there is a problem or is a red flag. In very severe form, you see all the standard veins on the abdomen, making it look like the head of Medusa. So medically, we say this patient has caput Medusae, which is one of the complications of chronic hepatitis B, and that is the portal hypertension. And then there's lots of fluid, and look at how the umbilicus looks like. They develop sometimes umbilical hernia. How do we make a diagnosis of hepatitis B? First, we do the surface antigen. And once the surface antigen is positive, it tells you that this person is infected with hepatitis B. The next thing we do is the core IgM, which tells us that this is an acute infection. For chronic infection, when you repeat the surface antigen 6 months after, it will still be positive. Or you can do what we call the serum IgG. That tells you that you have a chronic disease. E antigen, to remember, E looks like engagement. Okay, those who are E antigen positive, that is when the viruses are multiplying, they are marrying and then giving birth. So they tend to have lots of the virus in the blood, and therefore they are highly infectious. You should know that we do this profile to determine whether the patient has acute or chronic infection, and also to differentiate between E antigen positive and E antigen negative hepatitis. Now let's look at the myths that surrounds diagnosis of hepatitis B. My doctor definitely would have told me if I had hepatitis B or if I needed a test. And every year I do my medicals. That does not mean you don't have hepatitis B, because it is not routinely done as part of the things during annual. So you need to request for it to be done to know your status. If it's just the annual and they tell you it's fine, you don't know which ones have been done. So you need the full details of that. So for those with hepatitis B, these are the labs that we do. Apart from the profile, we do the viral load or the HBV DNA. We also do the LFTs, looking for inflammation. All these labs are available except FibroScan, which is not available in the country. Now we also do alpha fetoprotein, ultrasound scan, full blood count, INR. This can easily be done in the Kolibu lab, and it's even cheaper. We do the antibody test, the HIV test as well. So these two are also available. Currently, hepatitis D is not available. And people who have hepatitis B also tend to have hepatitis D in addition. And to remember that B meaning birth. If there's no B, there's no D. If there's no birth, there's no death. So D always requires the presence of B to be present. Now, how do we treat? Let's look at the myths surrounding treatment. People think that there's no treatment available for chronic hepatitis B. You just need to check your diet. No, that is wrong. We know that hepatitis B is not curable, but is manageable. And there are potent drugs that we do. And the drugs are supposed to suppress the virus such that it doesn't have any effect on the liver. Now people say, oh, if you are infected, you go to the hospital, they'll tell you it's not curable. But my traditional healer is saying that he can cure hepatitis. Nobody can cure hepatitis B. The whole world. Research is still ongoing. It can be controlled, but it cannot be cured. So if you have it, don't do traditional medicine, don't do the herbal medicine. Some of them have effect, negative effect on the liver. Come, and we will do you good in Kolibu. Now let's look at the algorithm. In terms of treatment, we only treat patients who are E antigen positive, whose viral load are more than 20,000 IU, and then the liver test, which is ALT, is more than 2 times the upper limit of normal. If you have this, then you require treatment. The other thing is that if you have cirrhosis, once you have it, it doesn't matter the amount of virus in your blood, doesn't matter your ALT levels, we treat. For E antigen negative, the difference is just that the positive is 20,000, the negative is 2,000. So these are the indications why we will treat you. Let's look at another myth. Now, these are the drugs that are available. Where the arrows are the recommended drugs. The tenofovir, entecavir, and pegylated interferon. But of all these, the preferred ones are the tenofovir. Now, in terms of the myth, and these ones, some of the doctors in the periphery are doing it. Oh, you have a hepatitis. Oh, don't worry, you are just a healthy carrier. Nobody is a healthy carrier. Maybe at that time, you did not qualify to be on treatment, but you need to be monitored. If you think, I'm a healthy carrier, and you go away, years later, you may come down with a complication. So that is something we should do. And the truth is that people living with hepatitis B may look healthy. Nothing at all. And sometimes the first sign of the disease will be when there is a complication, like cirrhosis or liver cancer. So for those who don't require treatment at the time they are being seen, they need to be monitored every 6 to 12 months for the rest of their lives. And don't be tired. Now, so what we are saying is that HIV is a dynamic, hepatitis B is a dynamic disease. Only 40% actually require treatment. And 60% of them may not require treatment, but they will require monitoring. And these are the people, when your viral load is less than 20,000 for E antigen, and then no cirrhosis will monitor you. If you are E antigen less than 2,000, and then undetectable no cirrhosis, will just monitor you. And the monitoring is done every 6 to 12 months. Now let's look at vaccination, prevention. So populations that are recommended for hepatitis B vaccination, once you are in Ghana, where the prevalence is more than 8%, if you are negative, you need to go for the vaccine. And in terms of the vaccine, we give 3 at 0, at month 1, and 6 months. If you just give yourself 1 jab, you have 30 to 55% protection. Second dose will push you up to 75%, and the third dose over 90%. So it's always best to finish your vaccination thing. Otherwise, if you do one, you are just half protected. Now let's look at the myths surrounding vaccination. Hepatitis B prevents liver cancer, the vaccine, and enhances healing in infected patients. No. Vaccination is for those who do not have the infection, to protect them from getting it. But once you have the infection, you don't need the vaccination. You need to be assessed rather for possible treatment. And then the other myth is that there's a vaccine for all types of hepatitis. No. When it comes to all the 5 forms of hepatitis, we only have vaccines available for hepatitis A and B. The rest, there are no vaccines. So what am I saying? Hepatitis B, in terms of the vaccine is very effective, especially in newborn babies if we do the birth dose. And it gives about 95% protection if it is done and done well. Now let's look at another myth when it comes to marriage. I got hepatitis B and I was told I can't marry or I can't have children. No. People with hepatitis B can marry. And if your spouse or whoever you are going to marry is negative, that person needs to go for the vaccine, and then you can live together happily ever after, having children without any problem. So those who are fond of doing premarital, especially in our churches, one person is positive, is a no-go area. No. The other person needs to be vaccinated, and they can marry and have children. Now, some people think that people living with hepatitis cannot continue having sex. Who told you? You can. Okay? If you are negative, go for the vaccine, and then you can enjoy yourself. You shouldn't deprive yourself of good things in this world. Now, the other myth is breastfeeding. It is not safe to breastfeed if I have hepatitis B. That is the myth. You can breastfeed. Breastfeeding is safe in people with hepatitis B. And it's even safer if that newborn child is given a birth dose of the hepatitis B vaccine. Now, I want to say a very big thank you, and I hope I've been able to demystify some of the things that we have with regards to hepatitis B. Hepatitis is real. Hepatitis cannot wait for us to act. Let's know our status and let's seek care. And at the Kolebu Teaching Hospital, most people think that, oh, there's a long waiting period. No, when it comes to hepatology, we have our regular clinics, and then we have VIP clinics as well, where you spend a very short time, get the top expertise to take care of your disease. We are looking forward to seeing you. God bless you. Thank you.
Thank you very much, Dr. Adjoa AJ in Cancer. I'm sure you all agree that was an excellent presentation, and indeed, we all have hepatitis demystified for us. I just want us to remember some key things she said. Hepatitis is preventable, but if you already have it, there is a way it can be picked up so that there are no complications. Now we've come to the next phase of the Kolebu webinar series, and we want to remind our audience online, Facebook, YouTube, Zoom, and our limited audience, thank you for tuning in. Before I call in the panelists so that we learn more about hepatitis, I want to remind us all that we are here because of one of our major sponsors, Roche Products Limited. We want to thank you so much, and also our media sponsors, City TV, City FM, Ghana Web, and Graphic. And we thank the various media houses who are here covering the program as well. Without wasting much time, I want to call our panelists, and I will introduce them briefly so that we appreciate who they are. First of all, I want to call on Madam Alice Dramani. Please, let's give her a hand. Madam Alice Dramani has graciously accepted to share her journey with hepatitis B with us today. Madam, please have a seat. Madam Alice Dramani works at Port Health at Tema, and she's an environmental health officer. Next, I will call Dr. Adjoa AJ in Cancer. She has already been introduced. She's an expert gastroenterologist and has a wealth of knowledge on hepatitis B. Next, I'll call Dr. Ofe, and I'll do a brief introduction of Dr. Asari Kweku Ofe. He is a consultant general and hepatobiliary surgeon at Kolebu Teaching Hospital, and he has extensive knowledge in many surgical procedures, be it breast, be it the thyroid, be it any organ in the body, and that was for the first level. Subsequently, he went on further to super specialize in the liver, the pancreas, gallbladder, and anything that has to do with the liver. And he has trained in world-class institutions in India and Israel. And he belongs to many international organizations. So, my dear ladies and gentlemen, I'm sure you agree that we have empaneled wealth of knowledge this evening to further discuss the issue about hepatitis. So please stay with us as we demystify hepatitis further. Thank you. Good evening, our dear panelists, and thank you so much for accepting to be here with us. Madam Alice Dramani, thank you so much, and we thank God for your life. So, Madam Alice, first of all, we want you to tell us what happened before you realized that you had hepatitis. How did it all start for you?
Thank you so much, Madam Moderator. I one day got up to go to work. When I got to work, I just sat down and I realized some heaviness in my foot. Before I realized, my legs swelling up.
Your feet became swollen.
And my abdomen became heavy.
Your abdomen became swollen as well.
Yes. So I left the office to my boss. I told him I'm not feeling well. But he asked me, this morning when I saw you were not sick. I said, I just feel something, I'm going out. So I got up and I went to a hospital to report it that this is what happened to me when I went to work. But I wasn't feeling sick. In fact, I've never been sick before. So I don't even know how to go to hospital. So that day I went and I didn't even know where to start from. So I asked somebody and he helped me. So when I saw a friend there and she took me to one of the doctors. The doctor asked me what happened and she just told me I should go. It's she doesn't know, but it should be fibroid. Do I have fibroid? I said no, I don't have fibroid. He was asking me some questions. I said no. So he later asked me to go to Bato Hospital. So the following day I went to Bato Hospital. That was where I was wearing the jean and the jeans couldn't come on.
So your legs were so swollen you couldn't even take off your jeans.
To my waist.
You couldn't zip up because of the swelling.
So the doctors in Bato said I should hang up the legs till daybreak so that it will be able to come. But daybreak it didn't come. So I have to come back to them. So when I came, the following day I went to the hospital again to tell the doctor who asked me to go there that this is what the Bato people told me. So he said he suspects that I have cirrhosis of the liver.
Okay.
Which I don't even
You didn't even know the name, hearing it for the first time.
So I continued going there, but there were no. One day a doctor told me, we don't have liver cure in Ghana.
Okay.
It's only South Africa.
So that's another myth.
So if you are having it, we don't have any cure. So when I came home, I started Googling on my phone.
You started Googling online?
Online,
okay,
to see what. So I saw something, Kolebu Liver Foundation. So I went through and I had a number there. So I called the number. It was around 10 to 11 p.m. So somebody picked the number and said, go to Kolebu. So it was the following morning. I got to Kolebu before 5 o'clock. So I came and I was waiting. So when I didn't even know what to do. So somebody met me and told me I should go back and get a referral to Kolebu. So I went back to the hospital where I started. The person said the doctor there said he cannot give me referral. So I went to a place again and a lady wrote the referral to me and I brought it to Kolebu.
Because Kolebu is a teaching hospital, so you need a referral.
Yes.
Okay.
So when I came, I was there and they called me to this, my God angel.
That's wonderful.
In fact, this woman is very good. So what I will even say is that anybody who is suffering of that liver condition shouldn't waste her time or his time outside. He should come to
Kolebu.
And I myself, anytime I see somebody with that condition, I just tell the person, go and collect your referral and go to Kolebu. The people will be telling me, can you show me the doctor? I said, no, you go there. If you just go, you will see someone who cured me. I don't hide what happened to me. When she saw me, she told me, Alice, the next time you come here, you'll be wearing a jeans. And that day, the dress I was wearing was very big because I was big in it. Every where in my body was swelling up, and I don't even know what is happening to me. So she took me to a small room, palpate my stomach, and brought me to the consulting room again. Then she said she wrote some
medicines for you.
Tests for me to go.
Some tests, okay.
Yes. So I went to the hospital there. That was
it was also done in Kolebu.
Yes, it was done there, and they told me I should come in 2 weeks' time. By the time I'll come the 2 weeks' time, there was medicine and everything attached. There is before she gave it to me. Then I left. After 2 weeks, water was coming out. This is the color. That's why I wear this dress. The color was yellow coming out of me. So I couldn't even control myself. I was just on the WC till daybreak.
Okay. So, Madam Alice, can we see the pictures? Because she really doesn't mind showing how bad it was. Her legs were really swollen. Her abdomen was really, really enlarged. And she couldn't even breathe at some point in time. So this is how big her stomach was the time it started. Okay? And this is Madam Alice, who is sitting here with us today. And she was also diagnosed with hepatitis B. These are her feet. You see how swollen her feet were. Can we go to the next slide? Okay, so Madam Alice, you said you were given some medications, and a lot of water started coming. Okay.
So it was like that about 3 months. So I came back again, and she saw me and with my trousers. That they wore the trousers.
Yes. At first you couldn't wear your trousers.
Yes,
but after 2 months of treatment in Kolebu, you were able to wear your trousers.
Yes.
We thank God. And we thank God for the experts.
So that was the time the healing started. So I was there up to now. I'm the one today.
We thank God. So thank you so much. I think she deserves a round of applause for being bold, searching out, going to find help to the extent of Googling and making sure that when she Googled, she didn't do the treatment by herself. She still went to hospital for the experts to help her. And as you can see, this is where we are today. Dr. Adjoy Jane Cancer, Dr.
Angel.
Dr. Angel, Dr. God, according to Madam Alice Jamani, I'm sure she's had a wonderful experience with you. Can you walk us through exactly what you saw when she came to the hospital and briefly tell us what kind of test she did and what kind of treatment you gave her? Because what we saw and what she is now, we thank God, and we also want to know if others can benefit from it as well.
Okay, thank you very much. Before I start, I'll issue a disclaimer. All glory be to God and not me. Yes. So when she came, she was in a huge dress. The abdomen was grossly distended. She could hardly breathe, and then was being held by, I think, the husband. Somebody brought her. So when she looked very ill, and she had to be admitted, but she was coming all the way from Tema. So what we decided to do was, let's do some small investigations, start her a little bit on the treatment, and then based on the investigations, we pick it up. So we realized that her albumin level was about 6, which was extremely low because of the cirrhosis. One of the functions of the liver is to produce albumin. But because her liver was almost packed, there was no albumin. That's why the feet were bare, swollen, and the ascites.
What do you mean by her liver was almost packed?
So what I mean is that the function of the liver was about 5%. Yes. And it was quite a challenging one. So what we did was that I restricted salt, put her on furosemide and spironolactone and screened for hepatitis B. So when she came with the results, hepatitis B was positive, viral load was in the millions, and her E antigen was positive.
Please, where did she do these tests?
So as she rightly said, she did everything in Korle Bu. And then when she brought the thing, because the E antigen was positive, that tells us that she got the infection at the neonatal level immediately after birth. And if you remember the trend, you start having the complications 30 years to 40 years. So that was the age in which she was, in her 40s. So this tells us that gradually, and the interesting part was that she didn't even have a clue what hepatitis B was. So going around saying that, boasting that I've never been admitted, I've never been to hospital, there was something eating her inside that she did not know. Yes. But when the complications came up and we saw it, by the grace of God, she responded very well to treatment, and now she's back to work. I mean, most people thought that was going to be her end, but now she's here sharing her testimony.
So we can see some more. Can you go back? Can you go back? So this is how it was when she came, and then when she was given the spironolactone and furosemide. Those are drugs that were prescribed, and she started taking them, and then she started seeing improvements. Can you go? So this, you can see, is still a little big, but it's better than before. The next one, this is where she has more or less recovered.
This is the first day I reported at work.
Oh, great. So after that, I'm sure you couldn't fit into this.
No, I can't.
She couldn't fit into her clothes at all, but yes, by God's grace, when she went through the treatment, she was able to return back to work. Dr. Adweje, apart from medications like spironolactone and furosemide, are there other forms of treatment? And you've also been saying something like cirrhosis. And then when you were doing your presentation, you also said something about cancer. Can you tell us a bit more about what kind of treatment needs to be given to which patients?
Okay, so when she was found to be also hepatitis B positive, then we started treating her using the antiviral. And now what I want to tell the audience is that if your tummy is big, don't go and buy the medicines we are talking about. We need to find out why your tummy is distended. So one other complication that usually will arise apart from cirrhosis with all this thing is liver cancer. And now when one develops liver cancer, then we bring in the surgeons. We bring in the interventional radiologists to help manage the liver cancer.
All right. So now we come to Dr. Ofe. When there is a liver cancer and we cannot take medications to address it, how do the surgeons come in to help address this issue?
Yes, so we are also happy for Madam the recovery, and in her case, she got a complication from hepatitis B. And one of the complications from hepatitis B is that your liver develops cancer. So what happens is that the liver is a very huge organ with a very huge capacity, such that you can take about half to 2/3 of the liver, and the rest can regenerate and function.
So it's like you can cut part of the liver. You can
cut part of the liver, and the rest can still survive. So we always say that you can leave just about 30% of your liver, and that will regenerate. Regenerate, we are meaning that the liver will multiply, will produce more cells, and become big enough to survive, for functioning. So it means that if part of your liver has the cancer, it is possible that we can remove it and leave the healthy part without cancer for you. But that means that the healthy part must also be free of any other disease. So if you have cirrhosis, it affects all the liver. And if part of the liver has cancer and the other part has cirrhosis, then your risk of getting surgery is less, because the cirrhosis may not be able to survive when we take the other part with the cancer. So it is possible that part of your liver is removed if it has cancer, and then you will survive on the other part. In some instances, the cancer has affected all the liver. In that case, surgery is not possible. So it is advised that if you have hepatitis B, you do the follow-up as Dr. Edwaje told us before, every 6 months. In that case, when cancer is developing, then it will be an early disease, early cancer, such that you have the chance of getting surgery and getting cured. In some instances, the liver is so damaged with cirrhosis that if you even remove part of the cancer, it won't solve the problem. The rest of the liver will fail. In that instance, then another surgery that can be done is to give you a new liver, which we call liver transplantation.
Are we able to do liver transplants in Ghana?
Not yet, but in the near future, Ghana will start its liver transplant program because we have a lot of these challenges. What happens is that the liver, which has cirrhosis and cancer, will be removed and thrown away, and then a new liver will be put there for you. So you start life all over again. That new liver has to be donated by another person, which is the challenge and the difficulty in this process. So it means it's better to prevent your liver from getting damaged than hoping that it's damaged and waiting for transplantation, which may not be possible, because if you don't get somebody to donate for you, then that's a problem. So the surgical approach is that we take part of your liver which has cancer, and then we leave the healthy part for you to survive. Or we offer liver transplantation for you, and then you start life all over again. In some instances, we don't need to remove the liver. What happens is that the cancer is so small, about 3 centimeters in size. In such an instance, we can burn the cancer. So you are put down, and then a probe or a needle is passed through the skin under ultrasound or CT scan, so that the radiologist will be able to see where the cancer is, put the needle in the state. You should be able to come early, so that we offer you curative surgery that your survival becomes prolonged. So these are the surgical means that when you develop complications of cancer, we can offer you in Kolebu Teaching Hospital.
All right. So a lot of these procedures, remember the test and even the diagnosis, the treatment and everything, it can be done at Kolebu Teaching Hospital. And one key thing that he said that I am taking away is the fact that you don't have to wait till the cancer grows. If you are diagnosed with hepatitis B, make sure, or hepatitis C, make sure that you present to the hospital. It is not the end of your life. There are several things that can be done, and they have to do the assessment. And Dr. Edwaje and her team at the gastro clinic will be able to make the right diagnosis, tell you whether you need treatment or not, or whether you need monitoring or not. At this point, I just want us to remind ourselves that this program is being sponsored by Roche, Ghana Web, Graphic, City TV, and City FM. And we appreciate everybody who is online and in here as well. So we'll take any questions that have been shared online. But in the meantime, Dr. Edwaje, assuming that I don't know whether I am hepatitis B or C, how am I able to determine whether I have hepatitis B or C? Is it a complicated thing? What exactly happens? What can I do to know whether I have hepatitis B or hepatitis C?
It's quite simple. You walk into the lab and then you can have it done. And just knowing screening for hepatitis B and C is not expensive at all. And most labs will do it for you. The other additional thing I want to add to what Dr. Fair said was that this interventional radiological thing where we bend the tumor is done in Kolebu as well. So those of you who are fond of traveling to the UK, to US, to India for that, we have it available in Ghana. So if you have that, you can see us and it will be arranged for you. And for the donors, you don't need to give your whole liver to the person. They just take part of your liver and give it to the other person. And whatever is left will grow and then will sustain you. Thank you.
All right. Okay. So we have some questions on Zoom, but you remember she said any lab. We have so many labs in Kolebu. Kolebu Polyclinic Family Medicine has a lab. We have Central Lab. We have Cardio Lab, Obs and Gynae, A&E. There are so many labs that you can have all these tests done, whether you are positive or negative. And if you have to even do other tests or investigations like a scan, a CT scan, it can all be done in Kolebu. If you need to see specialists for more treatment or you need medications, you can get them all at Kolebu. So we have some questions from the Zoom call. The question is, please, do you need to vaccinate again after 10 years of initial vaccination? You mentioned that we need 3 doses. So when I finish my 3 doses, do I need to vaccinate again after 10 years? And this question is from Dr. Seth Apia.
Okay, thank you very much, Dr. Apia. You don't need a booster dose. Now, the thing is that if you've taken all 3 vaccines, and the vaccines are potent vaccine, cold chain was ensured, then you know that for the 3 you are protected for life. But to be sure, there's a test that we do, we call it the antibody titers. You can do that if your titers are more than 10 IU, then it means that you are still protected. If it's less than 10, but more than 3, it means that there's partial protection. So that is when you may go for a booster. If you do it and it's 3 or less, it means that you haven't mounted enough immunity, so you have to start the whole series again.
So how often can we do this antibody titer test?
So the antibody titers, you can decide to do it every 10 years. I had my shot in 94. Last year I did my titers and it was 152. Okay. And that was so many years after, still the antibodies are fine.
Okay, thank you very much. So there's another question from Marianne. She wants to know, given the morbidity that might follow chronic hepatitis B infection, do you think it is advisable that somebody decides to do a checkup and then you add it to the panel of investigations that the person has to do?
I think it's right practice, because if you do that and the person is negative, you can vaccinate the person. If the person is positive, you can link the person to care, and that may save the person's life. So don't say that because of the emotional trauma, you are not going to do it. Patient may appear before you with a complication that you can't do much about.
Yes, so over here too, I'm sure we as health workers, we organize a lot of screening. And then when we screen and they are negative, we end it there. Let's remember to encourage them to go and get vaccinated. Otherwise, a few months down the line, they can get exposed and get infected. So when you see somebody who is negative, it's always advisable to offer vaccination. There's another question. How do you know whether your vaccination was effective? I think indirectly you answered it a bit, but just touch on it briefly.
Okay, so 4 to 12 weeks after your last vaccination, you can do your titers. And the levels I said can tell you whether it was good or not.
All right. And so that question was from John Joje Mensah. There's another question from Emmanuel Eduf Dazi, and he says, how preventive is it for newborns who get only hepatitis B vaccine and not the immunoglobulin due to the cost? So maybe you talk about the treatment we give to newborns when their mothers are positive during pregnancy. Then that's when they...
So when we look at prevention of mother-to-child transmission, it started in 1992, where WHO advocated that countries with high prevalence should have a vaccine. Now, 15 years after that, WHO noticed that it wasn't enough, and that now we require a birth dose in addition to the pentavalent vaccine. And now, few years, about 2-3 years, now we are saying that mothers who have even high amount of virus should have tenofovir prophylaxis to reduce the amount of virus, and then the children should have immunization. So with the childhood immunization, we have two. We have what we call the passive immunization and the active one. The passive one is with the immunoglobulin. These are already made soldiers or antibodies that we give to the child. But that is extremely expensive. One shot goes between 350 and 500 cedis. And many mothers, 600. Many mothers cannot afford. But with that birth dose, which is it can give protection to up to about 75%. And then when you add on the immunoglobulin, it pushes it up to about 80 to 85%. And if you add the maternal prophylaxis, then we are hindering about over 95% protection.
So it's important that pregnant women know their hepatitis B status,
yes,
so that they can protect their children.
Yes, but with the immunoglobulin, if you don't have it, the birth dose is equally very good, and that is what we should advocate for.
Okay. So there's another question, and it's from Edward Ami here. And he says, Dr. Nkansa, please further explain the birth dose. Is it the same as Engerix B?
Okay, Engerix B is a vaccine. So what we mean by birth dose is that within 24 hours of delivery, the baby should have the vaccine.
That is
so that is the monovalent
a baby born
to hepatitis B positive mother. Ideally, if you have a prevalence of 8%, then all babies should have that vaccine. And that's the birth dose. So what we mean by birth dose is the timing, 24 hours. The ideal thing should have been 12 hours, but maximum 24 hours, you give your vaccine. So it can be the Engerix B, and that vaccine is a monovalent. It is just the hepatitis B vaccine. What we are using now is a pentavalent. It's made up of 5 vaccines put together. And the diphtheria one, you can't give it when a child is born. The safest time to give it is after 6 weeks. That is why it started. But between day 0 and 6 weeks, baby can get the infection. That's why we advocate that give a vaccine, which is only hepatitis B, immediately after birth to the baby.
All right. Another question is, can breastfeeding start immediately after delivery before the neonate receives the vaccine or immunoglobulin?
Yes, you realize that the amount of virus in the breast milk is quite low. So it can be done, yes.
Okay. And somebody else wants to know, can we get a recording of the meeting? And I'm sure it will be uploaded later on. So definitely you will get the recording. So if you just joined us, you can get the full recording later on when you log into either YouTube or Facebook. Another question says here, can a person with inactive hepatitis B transfer it to someone?
Yes, but it is less so compared to somebody with a lot of virus. So when we say inactive, usually the amount of virus in the blood is quite low. And therefore, the risk of transmission is also markedly reduced compared to somebody who has lots of virus in the blood. It can, but it's very low.
Yeah, so this is a very interesting question, and I'm sure some of us health workers are guilty. He says, please, I am hepatitis B positive. Viral load was done and it was 2,340. But I went to the hospital and I was asked to take some liver supplements. He's mentioned the name, but I don't want to mention it. How do I go about it again? Because I don't know if I'm making progress. And I haven't done the load again since last year. Okay.
Let me come in.
Yes.
Doctor, when I went to that hospital,
yes,
they also gave me that liver supplement. And that was the time when I took it, I was bloated. You
became bloated?
Yes.
After you took the liver supplement?
Yes. So when I came, she told me, I brought it. And she told me, why? Now for you to take what will kill the viruses, and now you are now making the virus to grow. That is what she told me. So I went back to that hospital, and because when I was there, somebody too brought a complaint. That was the same liver tone. Let me tell them. Yes, that was. So that was the time I became bloated with the medicine.
Yes.
All right.
Yes. So Dr. Ejedu, what do you have to say about the supplements?
Okay, the bloating with the medicine could be just coincidence. Now, what they tell you is that it's a liver protector. I ask myself, if you have a big crack on your wall, would you paint it or would you mend the crack? So for somebody with hepatitis B, you either take the treatment if you need it or we monitor you. There have been patients who've come in, lots of them with liver cancer, they've been on these protectors for so many years. And it gives them the false assurance that they are on treatment. Meanwhile, it's just multivitamins. So I would say that in the management of chronic hepatitis B, these liver protectors are not part of it. It can be used for other things, but not in viral hepatitis. So if your viral load you did and it was 2,300 and something, unfortunately, you didn't tell us the unit. Every 6 months, you need to check your viral load to see if it's going up or it's coming down. Because today you may not need treatment, but in 6 months' time, you may require treatment based on the levels of your viral load in your liver test.
All right. So I have another question from Janet. She says, please, is the antibody test done in Kolebu? It is done in Kolebu. So I'll answer that. And then, how much is the cost of treating hepatitis B? Kobna wants to know.
It is very expensive. Yes. The basic investigations we do prior to knowing whether you need treatment or not will cost you on the average 1,050 cedis. And then if you need treatment, the minimum per the cost of the drug is 250 cedis every month. And for those who are e-antigen negative, you have to be on it for life. Those who are e-antigen positive, you need to be on it until you become e-antigen negative. And then you consolidate it for about a year or two. So every month, you need to cough out a minimum of 250 cedis. And then every 6 months, we need to repeat the amount of virus to be sure that the drugs are working. And that's also about 500 cedis.
So that's the viral load test. Okay. Somebody wants to know, Ronald, he says tests were done on a patient and the results came out as level undetected. So is it okay to vaccinate such a patient?
No, we will not vaccinate. Once you've ever been infected, you don't need the vaccination. Undetected, if you have the infection and the body fights it and becomes undetectable, the body builds its own antibodies to protect you. So you don't need to be immunized.
Somebody wants to know if the vaccination is free.
Not at all. Even for the newborns, they pay. So there's nothing free. But I say that it's cheaper to prevent than to get the infection.
Okay. And anybody can answer if you know of any herbal research which is going on in the fight against hepatitis B.
There is one gentleman who's come up with lots of things and then, as usual, saying all sorts of things. So I directed him to go to Ghana Health Service, the traditional way, so that they assess. I'm here to get any information on that. Because they always tell you the patient was positive, became negative. Some of them just use the liver function test, which is fluctuating. Today may be high, the next time it may be low, but it may go up again. And if you use that, you always make a mistake.
So it's better to use the
viral load in addition to the liver test.
So this goes to our clinicians as well. So there's another question, and I'm sure it's from one of our health workers. She says, Dr. Adjoa in cancer, can you please go over the cutoff value of the hepatitis B viral load above which you treat? Okay, so we divide it into two. The hepatitis, we have e-antigen positive and then for those who are e-antigen positive, the cutoff is 20,000 international units. And then for those who are e-antigen negative, it is 2,000. Sometimes you may find copies per mail, other times IU. It's just like a CD and a dollar equivalent. Nationally, we prefer using the IU to the copies per mail. Okay, your story. Somebody wants to know how old you were when the symptoms started.
I already said I don't even go to hospital.
Yes.
I've never been admitted.
So you've never been sick for most parts of your life?
No.
And then when your stomach became big, how old were you?
I was 43.
She was 43,
Yes.
so in her early 40s
Yes,
when
43.
it started. And tomorrow is her birthday, and she'll be 46. Thank you so much, Madam Alice, for sharing your story with us. There's another question. Is the vaccine covered by NHIS?
No, please.
Can you educate us on the schedule for hepatitis B vaccination? I think she mentioned it.
016. So you do one, the second shot will be in a month's time, and the third shot 6 months. So 0, month 1, and month 6.
Okay, so somebody is sharing that immune globulin, especially the is about $10,000 a bottle here in the US. We handle a bottle with our life when instructed to infuse it. Excellent program, proud of Kolebu. So that means it's relatively cheaper here. So we thank God that we are getting it relatively cheaper here, but it's important that we buy it when we have to. There's another question. Can self-examination like abdominal palpation help us in detecting it like we do for clinical breast exam in preventing breast cancer?
If you need to do that approach, then you are looking for advanced disease. But for the management, the earlier we see, the better. And imaging in terms of ultrasound scan is preferable than you doing your palpation.
Okay, so do we have any other questions? So let's remember this program is being sponsored by Roche. We have City FM, City TV, Graphic, and Ghana Web. And this is the first episode of the Kolebu webinar series. And it's going to be every last Thursday of every month. So look out for the Kolebu webinar series every last Thursday of every month. And later on, we'll be starting the scientific series as well. And that will be every other Thursday. I think it's the third Thursday of every month, every other Thursday. So those of us in here as well have some questions. I saw Dr. Isaac Cranton's hand up. Do you have a question or a contribution? Please, can we get a mic for him? So thank you all for joining us online via Facebook, Zoom, YouTube.
Thank you, Ajua. Ajua was my classmate in medical school. And we graduated the same year, but I told the part of pregnant women, and she went to the other end. I just want to find out whether the antiviral drug is teratogenic. Can we give it first trimester during pregnancy? Thank you.
Please, can you explain the teratogenic?
Okay, does it cause birth defects when you give it early in pregnancy?
Thank you.
Thank you.
Thank you very much. There are some that are teratogenic or give you abnormal babies, and that is contraindicated. Now, the only one that is allowed in pregnancy is tenofovir. And the reason is that it's been used for so many years in HIV-positive patients. And research has shown that in terms of teratogenicity, there's no problem. One of the two main side effects when it comes to the use of tenofovir is renal and then bone problems. A research was done, a meta-analysis was done by WHO, looking at the bone mineral density of the spine of newborn babies whose mothers were given tenofovir, and there was no significance compared to those who had placebo. So it is highly recommended you can use it. If a patient is on any other medication and gets pregnant, you need to change it to tenofovir. Thank you.
Yes, somebody wants to know, doctor, please, is it the public health nurses who give the short dose within the first 12 hours whilst on the ward?
Okay, they are supposed to, but you have to buy it for them because currently it's not part of our national guideline. It's in a guideline, but it's not being provided by the nation. So you buy it and they will give the shot.
Okay, so we are encouraging all pregnant women, whether you are hepatitis B or not, save towards getting the vaccine for your newborn. so that whilst we are waiting for the 6 weeks where they will start getting the free hepatitis B, at least you can provide it and the nurses will inject it, whilst we are lobbying to make sure that that also becomes part of the early dose from birth. There's another question here. Someone has some food and fruits. They want to know if you have hepatitis B, are there specific fruits or vegetables to eat? Is diet important? Is exercise important?
Okay, so what I would say is that patients with just normal chronic hepatitis B, no symptoms, normal diet, no food restrictions. 2 things we restrict: alcohol, smoking, because this can make the condition worse. Now, for those who develop acute hepatitis, who have jaundice, who are vomiting, then we restrict fluid. What we do is that we ask them not to take protein diets so that the liver will rest and recover. Immediately they are out of the acute stage, they go back to their normal diet. Patients who have cirrhosis, like lots of fluid in the abdomen, like the pedal edema, we restrict salt. And then we sometimes may have to manage their fluid intake to about 1.5 liters so that they are not fluid overloaded and making them uncomfortable and unable to breathe. Vegetables, fruits are encouraged. Healthy living is important, especially with exercise, because those who don't exercise, they tend to put on weight. They develop fatty liver. And if they should have hepatitis B in addition, that progresses the disease faster. So healthy lifestyle is very much important in managing patients with hepatitis B.
All right, so this question will lead us to an area we didn't talk about. We talked about the medical management, we talked about the surgical management. So what happens when the cancer is out of hand? Medicine cannot do anything, surgery cannot do anything. And then somebody wants to know the life expectancy for hepatocellular cancer if it requires palliative care.
Okay, so depending on the size, as we said, if it's quite small, we can do interventional radiology, we can do surgery. Sometimes if it's beyond surgery, then we can have a medical management where we use certain medicine. We don't call it chemotherapy because they don't respond well to the usual cancer drugs that we have. But what this drug does is that it starves the tumor of the food, and we call it sorafenib. It's a tyrosine kinase inhibitor. So that when they take it, blood does not flow into the cells and is able to extend their lives for 3 to 6 months. And currently, 1 month supply is 3,500. And that is just to extend your life for about 3 months, maximum 6 months. Prognosis depends on the size of the tumor. And what we are saying, within 3 to 6 months, maximum up to a year, they are gone.
So let's remember, we don't want people to get to that stage. But even if you get to that stage, we have a palliative unit at Kolebu Polyclinic Family Medicine that helps you through your journey towards end of life. But we don't want majority of people to get there. However, if you get there, Kolebu is still there to partner you and make you improve your quality of life towards your end. Madam, please, if you can speak. There's another question in-house.
Thank you, Dr. Ajoye, for your presentation. Please, if a man is positive, hepatitis B positive, and the wife is negative, and the wife becomes pregnant, what happens to the baby? Does he go through the same treatment?
Okay, so once your husband is positive and you are negative, you need to go for the vaccine. But if the mother at the time of pregnancy is still negative, the mother can vaccinate so she doesn't get the infection. Towards the end, if the mother is still negative, then the child will just need a normal birth dose vaccine and continue with the 6 weeks, the 10 weeks, and the 14 weeks. So the father cannot directly transmit the infection to the baby. If anything at all, it should be through the mother. So the mother should put in precautionary measures so she doesn't get infected.
Somebody wants to know, okay, my baby was not given any dose of hepatitis B vaccine within the 12 hours of birth. So will the 6 weeks dose be safe for her? I think there's a myth you need to demystify.
Yes, if you miss the birth dose, the 6 weeks, the 10 weeks, the 14 weeks is there to help. So yes, the child can do that.
Okay. Can the immunoglobulin be given after 72 hours?
The recommendation is that the vaccine should be given up to 24 hours. Immunoglobulin up to 72 hours. After 72 hours, the effect compared to the benefit is not useful. So try and do it within 72 hours.
Natasha wants to know, if you are hepatitis B patient and you are pregnant and not under any treatment, can it affect your baby, as in cause you to lose the baby? Will there be any complications to the baby?
No. The only thing is that if you should get infection that is affecting the placenta, then sometimes it can cause the baby to be infected. So what you do is that if you are positive, if you can't do the viral load, at least do the E antigen. And if you are positive, you can be started on treatment to reduce the amount of virus in the blood. And this is usually done at week 28.
Okay. So another person wants to know that, for instance, the immunoglobulin, when it is given at birth, is there any other time in the baby's life that it has to be given again?
No. So the immunoglobulin is given to protect the baby whilst the vaccine takes time to produce its own antibodies. So the one shot should be enough.
Okay. So this is an interesting question. Given the numerous bitters on the Ghanaian market and the dangers presented by hepatitis B, what rigorous education campaign is going on, particularly in the villages, to be mindful of this in order to save lives? Forgone too soon is very rampant in Ghana today.
That's a very good suggestion, and that's one thing we need to work on. Because if you have a high prevalence of hepatitis B and your alcohol consumption is high, as well as hepatitis C, then it doesn't work too well, both for hepatitis C and B. So